Looking at the posterior lower right leg, and first two muscles we can point out are going to be the medial head of the gastrocnemius and then the lateral head of the gastrocnemius. If I reflect those two muscles, we can see this skinny tendon that connects to this small muscle belly right here, and that's going to be the plantaris muscle. And then deep to the plantaris, we can make out the soleus right here. And those three together, we can see they all converge to form the Achilles tendon, which is really called the calcaneal tendon. And we can see it'll cross over the heel, that when those muscles contract, we'll get plantar flexion of the foot at the ankle joint. You can see that pretty well here. If I go ahead and pull on that Achilles tendon, you can see the foot moves a little bit. Right? So that is mimicking that plantar flexion of the foot at the ankle. However, the gastrocnemius and the plantaris, those two will actually cross the knee joint. And we can see that we cut right here, part of that gastrocnemius, but if you follow it up, you can see that it courses over that knee joint on both sides here. So not only will it plantar flex the foot at the ankle, but it can also flex the leg at the knee. Same with plantaris. However, the soleus, which we can see, the soleus, we follow it up, will not cross the knee joint. All right, so it'll originate from the head of the fibula on that lateral side. So it's only going to have an action at that ankle joint. All right, and then the last muscle over here, if I move all that out of the way, move all these vessels out, we can make out this muscle right here, which is called the popliteus muscle. And in terms of function, when our leg is extended, it'll help initiate that knee flexion. So it'll help pop our knee out of extension to get us starting into that flex position. So starting from extending and then help us flex that knee.